Well, welcome everyone for another edition of the Bulletin Brief. We have an opportunity to discuss yet another article from the RAS August 2021 edition of the Bulletin of the American College of Surgeons. And I'm really excited today to introduce the chair of the Advocacy and Issues Committee of RAS, as well as an abdominal transplant fellow at the Mayo Clinic in Rochester, Dr. Randy Ryan. She wrote a really important and I think exciting article entitled Surgical Advocacy in Action, Challenges, Accomplishments, and Future Direction. So you and your authors, Dr. Ryan, covered a myriad of different areas where the American College of Surgeons has been instrumental in advocacy, also pointed to a few areas that we're continuing to work, and also then pointed out some tools that can be really helpful in advocacy. I was hoping to start off with talking a little bit about previous efforts that surgeons, in particular, have worked on advocacy. And one of those areas was surprise billing, which, as you noted, has gotten a lot of attention on Twitter recently with a Twitter personality. Can you tell us a little bit about surprise billing and what work has gone on in that area?
Yeah, so I actually remember the last time I was at the Leadership and Advocacy Summit in person. This was one of our topics that we talked to our legislators about. And so surprise billing is basically patients who go to a hospital for emergent care and need an emergent surgery, or they're getting worked up for that, for example, may find a medical bill that they did not expect, hence the surprise. And it's because even though they went to an in-network hospital, there was a provider at that hospital who was out of network. And so it's a rather unrealistic situation for the patient to be able to know that, for example, the radiologist who read their CT scan and helped diagnose appendicitis was out of network. And so maybe then that charge for that radiologist's work would not be covered. And obviously, this is something that's very unfair to patients. And it's not feasible, especially if people are able to have healthcare and they're responsible enough to go to their in-network hospitals and providers. And so that was a topic of the Leadership and Advocacy Summit a couple of years back, and we actually had success with these advocacy efforts. There was legislation that was later passed in December of 2020. And so this legislation mandated that the insurance plans were not able to add these charges to the in-network amount if it was obvious that this was an incidence of surprise billing. So that's a nice example of one where we were able to advocate for our patients and we got a win for our patients.
Sure. And I think that, as you alluded to, many individuals would not have any suspicion that this would be the case, that maybe their bills would be more than they would expect. So, and I really liked how you provided that example in the manuscript about how you can just go in and have an emergency procedure and have this bill that you really wouldn't expect at all. So an incredibly important win and incredibly important issue. Another issue that I think is near and dear to all of our hearts in medicine has to do with the EMR, or the electronic health record, where there was that issue of meaningful use, and I think many of us probably use another term for that, other than meaningful use, perhaps. But tell us a little bit about the college's efforts and others' efforts with regards to EMR-related issues.
Yeah, so the American College of Surgeons was in communication with the CMS, or Centers for Medicare and Medicaid Services, and the Office of the National Coordinator for the Health Information and Technology. And so this was sort of an effort to improve EHR processes. And so the ACS made recommendations of ideas for streamlining processes, optimizing ways that we log into the EHR, sort of all these little things that, yeah, it might be one little click, but if you're doing that little click, 40, 100 times a day, it takes up a lot of time. And, it's sort of time that we're not able to spend with our patients. And so the efforts here sort of became apparent in the Bipartisan Budget Act of 2018. And so a portion of this act helped reduce meaningful use obligations for physicians in the EMR. And it allowed for a diminution of the administrative burden for surgeons, which again is another win and another way that it's important to have our voice be heard, because The people that are designing EMRs, sometimes a lot of it's around coding and how we're going to basically receive payment for these health services. And obviously we're taking care of the patients. We see how it's affecting patient care and our ability to care for patients. And so it's important that our voice be heard in those situations so we can make meaningful changes like these.
Absolutely. Another area which is really ongoing because the pandemic's not over yet. Hopefully, we're starting to see the light at the end of the tunnel. Has been really pandemic-related issues that the college has been very active in advocacy in a couple of different fronts. Kind of early on, it seems with PPE was kind of the major barrier, really limiting our ability to care for patients, and now really trying to decide on prioritization of care. Could you speak a little bit to those advocacy-related efforts?
Yeah, and so, regarding the COVID-19 pandemic, there were efforts at the level of the sort of higher up level of the ACS, but also at the level of RAS, or the Resident Associate Society. But for the part of the ACS, leaders from the ACS, as well as the American Society of Anesthesiologists and the Association of Perioperative Nurses, drafted a letter to political leaders after the pandemic broke, and we sort of have had these issues of access to PPE, healthcare safety, a shortage of healthcare, sort of a shortage of resources. And so this was just a letter drafted to political leaders stating that, we were having issues and that they needed to be addressed. And this was really important. It raised awareness to our political leaders that we needed national efforts to increase federal assistance to hospitals that were suffering during the pandemic.
Sure. No, absolutely. Yeah, no, go ahead, Dr. Ryan. I think I interrupted you.
I forgot the other part of it, the RAS portion of it, Julia Coleman, who was the former RAS chair, she came before me, and she really did a lot of great work on a lot of really good projects, but she started the COVID-19 task force. And this was a survey that we distributed to RAS members. And so it was feedback on their experience during the COVID-19 pandemic related to things such as shortage of PPE, but also the impact on our education, the fact that surgeries were getting canceled, that we were potentially not getting all the cases we needed for our training. And this was important. This gave us hard data of the residents' experience. And, I think she's in works to use this data moving forward to make sure that residents are well supported, especially now that we have the Delta variant and the COVID-19 pandemic seems to be ongoing at this point. And there was also an important factor in that related to burnout. And I think that's always an important thing to address because this has been a stressful time in a lot of ways for healthcare providers overall and residents. And so it was nice to gather some objective data so that we can use that moving forward to advocate for residents during this pandemic.
Sure, I think that type of information is critical to have, because the anecdote is one thing, but certainly having a little bit more hard data to base it upon is fantastic. And I really commend RAS for collecting that type of data in a proactive fashion in a relatively short notice.
Mm-hmm.
Speaking of residents and training, certainly one of the concerns, of course, is that we don't have enough residents and frankly won't have enough surgeons. Could you tell us a little bit about workforce related issues and what the college has done there, and perhaps maybe even what RAS has done in that arena?
Shortage of residents is a big issue, and it impacts the currently training residents because fewer residents means more work to spread around between the currently training residents, which impacts our education in real time. But also we need to make sure that we are supplying the workforce with enough surgeons for the future, especially as our population ages. And so one of the efforts was to increase the number of residency spots. And there was some success in that arena. I think it's going to be in the next couple of years, there's going to be an increase in the number of residency spots nationally, but it's total residency spots. So it's not just surgery. So there's a lot more work that we have to do in this area in order to keep up with the need. 1,000 resident spots or so at 2 years in the future, by the time that happens, we'll probably be even more behind. And so I think this is going to be something that the college and RAS needs to keep their eye on, and to continue those efforts to increase the number of residency spots. And the other important caveat to that is where the residency spots are. So there's a desperate need for rural care in America. And I think that starts with being able to train people in underserved or rural areas. We have a lot of residency positions that are concentrated on the coast. And so the question is, yes, we're going to, if we're able to make more residency spots, I think we need to make sure that we have a voice in advocating for making sure that these residency spots are in places where they're going to sort of not only serve residents and resident education, but also serve the communities in America, and not simply just in areas of high population concentration.
Sure. I think that rural areas in particular, I think have been really highlighted as having a tremendous shortage. And I agree with you that it's a multi-factorial issue. It's not just numbers, but location as well. So thanks for highlighting that. I think it's incredibly important.
Mm-hmm.
One additional area, and I know as for all of us and surgeons, I would say in particular, this is always an uncomfortable issue to talk about, but it's something that's so critically important with regards to ensuring access. It's just like the surprise billing issue highlights, which it has to do with payment. And in the past, of course, the American College of Surgeons was instrumental in addressing SGR. And if you can kind of explain to us a little bit about SGR and kind of the issues associated with it. But we have a kind of a similar situation now with Medicare payment cuts coming up, I should say. What could our role be with regards to that? Why is it so critically important? And how were we successful in the past?
Yeah, so I remember the SGR, the Sustainable Growth Act, had just been overcome or overturned. And that was a really big win for the American College of Surgeons. And I remember this because the first year that I went to the Leadership and Advocacy Summit, we spent a lot of time talking about what a great job we did in eliminating the Sustainable Growth Act the year before. And so what that was basically just a systematic series of reimbursement cuts that were supposed to be, or that were happening over a series of years. So our new version of that is the Medicare payment cuts. And this has been an ongoing topic for quite a while now because it was imminent. Medicare payment cuts were imminent kind of right when COVID was hitting. And so luckily with the COVID-19 pandemic and the shortages that we were suffering because of that, there was sort of an urgent need to put this off. And so it was. We were able to delay Medicare reimbursement cuts during the COVID-19 pandemic, but we weren't able to eliminate the topic completely. And so this still is a topic in the legislature, and it's still set, we are still set to have Medicare reimbursement cuts in the future. And this is something, among us RAS members, we have drafted letters to our representatives in Congress to say this is not good for medicine and this is not good for caring for our patients. And, I think when you're talking about reimbursement, obviously you're talking about payment, money, and it is true, you don't want to say that I put all these efforts into talking to legislative leaders about what I'm getting paid, but that's not really the issue. The issue is that reimbursement is sort of what is funding the whole healthcare system. It's not necessarily, we don't want this bill because we want our salaries to be higher. It's things like, I want to be able to continue running my own private practice, and I need to be reimbursed adequately to keep that private practice open, and to be able to afford liability insurance. And so, when it comes to reimbursement, yes, part of that is paying for physicians and the fee for their services, but it's also supporting the healthcare system as a whole. And again, you can look back at, aside from reimbursement cuts, looking at the fact that Medicare reimbursement rates for a long time, and I think still did not increase with inflation. And so, something like in the 1990s, the reimbursements rates haven't increased with inflation. And this is another issue with independent hospitals not being able to stay open, and sort of this idea of these big hospital systems sort of swallowing up all these little hospitals, and again related to rural care and rural practices and hospitals being able to stay open. And so I think it's important for people who want to be involved in advocacy to remember that when it comes to reimbursement, there still is a component in there that is related to caring for patients and serving our patients. And you can't do that if you can't keep your doors open.
Sure. No, and I think you really highlighted that issue of smaller hospitals, particularly rural hospitals. And I think there's really good data that shows that if a hospital closes in a community, the likelihood of that community being successful in other areas is quite low as well. Because without healthcare, frankly, folks are not able to stay in the area. So I think that's an incredibly important issue. And I think still a very timely issue, because there's still opportunity for us surgeons to be advocates, either through Surgeon's Voice or directly contacting our legislators to really urge them to act sooner rather than later. Because also the uncertainty of not knowing if a practice is going to be able to afford to pay rent or pay its employees is really just problematic for smaller practices and smaller systems. So a very important issue.
Right.
The final issue I was going to, or area that I wanted us to cover from your manuscript, was having the tools that are available. And you already alluded to the Leadership and Advocacy Summit, which I think you've attended several times, is my recollection.
Yes.
But there are also other tools as well through RAS, as well as through the larger college. Could you touch on some of those opportunities?
Yeah. So I kind of did it backwards, because the Leadership and Advocacy Summit was the big conference that I went to in DC. That's hosted by the American College of Surgeons. And that's sort of how I got involved in the RAS Advocacy and Issues Committee. And the Advocacy and Issues Committee is one of the 4 main committees in RAS. And we focus on advocacy efforts, so legislative efforts, and sort of keeping up to date on what's going on and what we can do to advocate for ourselves and our patients. But it also addresses issues with resident training and our education, finding jobs, the workforce shortage that we had talked about. And so the Advocacy and Issues Committee is a great way to sort of access this world very easily. You just call in every month. For the first few times I attended, I didn't even say anything. I just listened. And then eventually I listened enough that I thought I had heard enough that maybe I had an idea to add to this topic that we've been discussing. And it's nice because it's very accessible. And it's a group of your peers. But this is also a sounding board to the ACS and the leaders in the ACS. And so there's a lot of interaction between the American College of Surgeons leadership and the RAS efforts and committees. And so that's important because it sort of ties the whole thing together. When you look at the American College of Surgeons and you're a resident, you think, well, that's a big organization with a lot of important people. And then all of a sudden you have this RAS committee that you can join, and this is so much more accessible. And then all of a sudden you notice, oh, this is very intricately associated with the ACS. And so it sort of provides sort of a path for you to start getting to know people in the American College of Surgeons, getting to know your future colleagues, and opportunities for leadership and continued advocacy efforts as you sort of move on up. So the RAS Advocacy and Issues Committee is really sort of a great way to get started.
Sure. And as you suggested, really low barriers for involvement. Pretty much anyone who's a resident associate member can just call in and be a member right away, in a sense. Great. Well, one of the challenges that residents have, of course, is time. Let's say there's someone who's listening to our discussion today and says, I really would like to do something, but I'm just a little busy. Certainly, Leadership Advocacy Summit, I want to attend. Sounds like a great event, but probably not this year. What's one thing that they could do right away that could have an impact and maybe not a huge impact, but it's a start, right? So what would you suggest to them?
I would say probably the thing that takes the least amount of time, if you are a member of the American College of Surgeons, which most residents are through their programs, is send, whatever topic that is sort of hot right now that we're advocating for. So right now it'd be the Medicare reimbursement cuts. Sending a drafted letter to your representative. This sounds like a lot of effort, but actually the American College of Surgeons makes it very simple for your voice to be heard as a part of this large organization. The Surgeon's Voice is a website that you can go to, and they already have a pre-drafted letter, and you can edit it if you want to, make any changes you want, but then you can send that letter off to your representatives in Congress. And so I would say, in terms of the amount of time and the ease, I would say that's the thing that you could do that would be the most impactful in terms of advocacy. But otherwise, I would say that, another thing that's, like we said, low barrier and easy is to call into a meeting, call into the RAS advocacy and issues meeting and just listen. Now, it does take an hour of your time, but if you have to leave, you can leave. It's easy. You can come and go as you please, but it's a way for you to just start listening, and then you kind of start getting ideas of things that interest you and projects that are going on. And even when you get more involved and you're helping with articles or projects, there's a lot of members that are involved. And so it's you and 3 other people that are working on an article. And so everybody's sort of taking a separate part. And so it sort of makes it a much more time friendly. And you're able to be a part of something that's impactful, but that's realistic for you as a busy surgery resident.
Fantastic. Well, thank you for those tips, and I think that really just highlight how easy it is to start your involvement in advocacy. As I think many have found, is once you start, you kind of get the advocacy bug and keep doing more and more. So I think that's a great set of tips. Yeah. Well, Dr. Ryan, thank you very much for your time. Anything that we didn't cover in the manuscript or with regards to advocacy that you wanted to touch on before we wrap up?
Nothing that I can think of. Just to remember that you can always start small, and it's not as big and intimidating as it seems. I will say one thing too. At our advocacy and issues meetings, we get updates from the American College of Surgeons Division of Advocacy and Healthcare Policy, and these are experts. These are expert lobbyists that work for the ACS and on our behalf in DC. And so we have sort of the medicine and the anecdotal story side of things, and they have all of the legislative jargon and sort of what certain steps in Congress mean. And so that's also another way that you're able to sort of get an idea of how things work. Because I think legislation and politics can be intimidating because, we're used to knowing a lot about something that we're doing as surgeons. And so sometimes it's like, I don't know how you go about changing laws, and I don't know what this legislation means. And so that's another great resource for us, again, provided through the American College of Surgeons, that allows you to get involved and have a better understanding of what's going on in DC.
No, I completely agree with you, Dr. Ryan. Christian Chalgen and his team are just really incredible, aren't they? And a tremendous resource that we have, and really accessible as well. I found for not only national issues, but state issues as well. So yes, I completely agree with you that they're a tremendous resource. Well, thank you again, Dr. Ryan, for your time. And I think we'll be having another conversation in the near future about the RAS Symposium. So I'll be speaking with you soon.
That sounds great. It's an honor to be able to chat with you, and be able to get the word out. I really appreciate it.
All right. Have a good day.
You too.